Before we get perfect. My name is Emma. I use she, her pronouns. I am one of 4 of the folks who have helped plan this. And we just wanted to introduce ourselves real quick first.
Hi, everybody. Thanks for coming. I'm Amanda, and I also use she, her pronouns.
Hello, I'm Seth. I use he, him, his.
And I'm Marjorie. I use she, her pronouns.
Can you go back one, Amanda? Thank you. All right, so we'd first like to make a land acknowledgement. We'd like to recognize that Indigenous peoples are the traditional stewards of the land we now occupy, living here long before Chicago was a city. The University of Illinois Chicago resides on the traditional territories of the 3 Fire peoples, and the area was also a site of trade, gathering, and healing for more than a dozen other Native tribes. As we work, live, and play on these territories, we must ask what we can do to right the historic wrongs of colonization and state violence and support Indigenous community struggles for self-determination and sovereignty. All right, and this event tonight is hosted by UIC's Radical Public Health, which is a collective of students, alumni, faculty, and community members that seek to address the systemic underlying causes of public health challenges and to consider more radical solutions. RPH hosts group discussions, guest lectures, teach-ins, and engages in protests. If you're interested, we will have our email at the end, and we'd love to have you.
Okay, and before we get started, we just wanted to give a quick content warning. Some of these things on the screen might come up tonight, so we might discuss obesity, eating disorders, disordered eating, and trauma. So we just want to let everybody know before we start, and please make sure that you do any form of self-care that you need if any feelings come up or any of those things might be triggering for you. And then we also just want to talk about a couple of community guidelines. So please, because there's a lot of people on this call, keep yourself muted unless you're asking a question during the question and answer portion of this event, which will be at the end of the event after the speakers have gone. But you're welcome to leave questions in the chat and we will address them at the end. Also, be prepared to be uncomfortable. A lot of the times when we're talking about systems of oppression, it can also bring up a lot of uncomfortable thoughts. And so, it's okay to feel that way and just be prepared to maybe sit with those things and also do any self-care that you might need as those things come up. Avoid any tone policing. If you are asking questions, please put your videos on so we can see you. And then listen with love, please. Be here. The speakers have so wonderfully dedicated their time to tonight. So please also use active listening and humble listening and really try to pay attention as much as possible. Remember, like some of these topics are new and ideas are new. So please challenge the idea, not the person. Be open to making mistakes and signal when you don't understand. And we are all trying to learn here. So we want to create a community that's as respectful as possible. And then I'm not going to read through all of this, but this is a little bit of vocabulary in case you're a little bit newer to talking about fat liberation and fat phobia. And we will send out these definitions on the resources list, and everyone should have access to see that. And so just in the same vein, we've sent out a resource list that has good books to read and links and articles and people you can follow on social media and things like that if you want to keep learning more. And we are always taking other suggestions. So if you want to add anything, feel free to email Marjorie, who sent out the email to you all, and we can add more links to that. It's a working document. But before I pass it over to let the speakers start, I just want to read two quotes that are both from Sonia Renee Taylor, who's a wonderful body and fat liberation activist. And so the first one is, saying I'm fat is and should be the same as saying my shoes are black, the clouds are fluffy, and Bob Saget is tall. It's not good, it's not bad, it just is. The only negativity that this word carries is that which has been socially constructed around it. And the second one is racism, sexism, ableism, homo and transphobia, ageism, fat phobia are algorithms created by humans' struggle to make peace with the body. A radical self-love world is a world free from the systems of oppression that make it difficult and sometimes deadly to live in our bodies. So hopefully that frames the conversation a little bit. And I will pass it off to Seth to introduce our panelists.
Thanks so much. Yeah. I just got to say, I'm so grateful for everyone who's here. I think we have a really great turnout today. And I'm so excited for this amazing group of panelists and excited to learn and be in community with all of you. So we have three panelists today. We have Mikey Mercedes, Harriet Brown, and Monica Kriete. And in a moment, I'm going to have all of them introduce themselves and just share a little bit about what got them into this work. And we can just go from left to right on the screen. So we'll have Mikey go first, and then Harriet, and then Monica. But before we do that, today is Mikey's birthday. So if we could all say happy birthday to Mikey.
You guys are great.
Happy birthday, Mikey.
Thank
Happy
you.
birthday, Mikey. I forgot to make a sign, but I'm doing jazz hands.
Yeah, this great. This is honestly just like the best place I could be to celebrate today. So, oh my God, that's so many happy birthdays at once. Okay. So let me, wow. Okay. All right. Wow. Okay. Thanks, guys. It's very sweet of you.
Yeah. So thank you all and feel free to continue saying happy birthday in the chat. So we're so honored and grateful that Mikey is choosing to spend her birthday, at least for the next hour and a half, with all of us. And yeah, so Mikey, if you're ready, would you mind telling us a little bit about yourself and what got you into this work?
Absolutely. So I am currently a second year PhD student at Brown's School of Public Health. It just so happens that, like, I think the best way to describe how I got into this work is just growing up in the Bronx, among a majority Black community that was underfunded and low resourced and also systemically ignored by systems that were built to protect us, supposedly. But what actually propelled me into doing fat liberation things in public health was actually my first semester in my PhD program, and noticing how people spoke about fatness and how people sort of conceptualized how people gain weight and what that existence was. And also just like my personal experiences being on campus as somebody in a larger body and also somebody who's a person of color. But yeah, I guess you could say I'm a writer. I write things about this specific area alongside doing my PhD in sort of the intersection of fat phobia, racism, and anti-Blackness. Specifically in the context of provider-patient interactions. So that's sort of where the bulk of my expertise is. I also do research with a few centers, a few labs, and I am so stoked to be here. So thank you for having me.
We're glad to have you. Thank you so much. And Harriet, if you want to go next.
Sure. Yes, thank you for having me and for putting on this event. It's really fabulous. I actually am a journalist and teach journalism at Syracuse University's Newhouse School. But as part of my teaching, I also teach about Well, I developed a course called Fat and Feminism, mostly out of frustration about what wasn't being taught and what wasn't being said. And how I got into this work is very personal. You know, it's growing up in a family that was very focused on weight. And at a time, you know, in the 60s and 70s, when there was only one way to be if you were a girl. And I wasn't really that, or at least I felt like I wasn't that. So I had the experience of growing up and, you know, dieting, losing weight, regaining it, losing it, regaining it the way most people do, until I was in my 30s when I, you know, looked for a therapist who could help me with my intense feelings of self-loathing. And I was lucky enough to stumble upon Ellen Satter, who became my therapist. It was just dumb luck, basically. And it changed my life. But I still remember, you know, one of the first things she said to me was, well, you know, what if you were just okay with your body the way it is right now? And my response was rage, basically. Like, how dare you? How dare you? I came to you for help in getting my body under control, and you are telling me just forget it, just let it go. Like, and I stormed out of there. But I went back, you know, because what she said rang something somewhere in there. So that was sort of, and then we began work that we did together for 10 years, actually, and that was really life-changing for me. But during that time, I also had the experience of my older daughter, who was 14 at the time, developed anorexia and was very sick, almost died. And in the process of supporting her recovery, I felt like I sort of saw the other side of the issue, you know. So I had always come at it from, I feel like my body is wrong, it's too big, it's too whatever. There's all this social criticism. And then suddenly there was my daughter, who was, you know, gaunt and sick, and strangers were coming up to her on the street, literally, and saying, oh, my God, how do you keep your figure? You're so beautiful. You should model, blah, blah, blah. And as she began to recover, gained weight, got healthy, you know, all that stopped. So there was a lot of specific incidents that happened during that time that helped me understand that this was a systemic issue, not just my personal failing, right? So that was like a long journey that I had to make to sort of get that, wait a minute, it's not just me. This is deeply embedded in the culture. And then I started researching and writing about it. So yeah, and I still do. So that's me.
Awesome. Thank you so much for sharing that and bringing some vulnerability into this space as well. And I'll just add, I was a lucky recipient of that Fat and Feminism class as an undergrad at Syracuse. So I appreciate you for being that person in my life who is the first one to kind of expose me to some of these ideas. Yeah. So Monica, take it away.
Okay. Tough acts to follow. Thank you all so much for being here and for having me again. So Fat Liberation found me. I don't think I found Fat Liberation. And I read a really good tweet the other day that said, before you do good research about something, you have to be confused about it. I've been confused about medical fat phobia since I was 7 years old. I remember learning what a percentile was in a pediatrician's office when I was 7 years old. And I was like, my body's supposed to fit the paper and it doesn't. And that makes me bad. And it's just been this lifelong process of trying to understand what that was about. I also had a lot of cultural, familial weight stigma in my family that we've worked through. Shout out to therapy. The career side of it is I also was exposed to Fat Liberation during undergrad, not from a professor, but just from the Google machine, kind of learning about, I was learning about feminism online as well, right? This was like kind of peak feminist blogosphere, like 2007 to 2011 is when I was in undergrad. So I was learning about that, and then it kind of clicked like, oh, I can get college credit for doing this in my feminism classes. So I was doing like gender studies classes and doing a little bit of teeny tiny fat studies research. I ended up, so my major had been biochemistry, and I am like a full disaster in the lab. Like, I have no coordination. I could not make anything happen. It was a really big nightmare for everyone involved. So I ended up in public health almost by accident, kind of like what's the Venn, when the Venn diagram of biochemistry and gender studies overlap, it's public health. And so I went and I worked at the National Membership Association for OBGYNs for 5 years in communications. And so I ended up choosing to go to grad school. We saw a lot of stuff about obesity come through. And I saw, kind of the other side of what Harriet was talking about with being a journalist, where I was the person sending out the papers to get covered. And so maybe we emailed back in the day. Seeing, like the obesity stuff gets picked up and it gets reported out exactly like it's presented in the journal, and like nobody's really digging into it. Nobody's thinking critically about the implications. We're just talking about one study like it's the be all end all of everything. That was really frustrating. And I kind of came to grad school to try to get to the bottom of it. So I ended up doing my MPH at Harvard with the explicit plan of going in and talking about weight stigma as a public health problem. I expected to make no friends and influence no one. And I radicalized basically my entire cohort, and have kind of tried to turn that into a career moderately successfully. Like, I want to be really clear that I would not be where I am without a shitload of class privilege. Also, sorry for dropping the first curse word. That, like in the pandemic, I moved back in with my parents and they had room for me, and it's been honestly kind of great. But I also really recognize that that's not possible for everyone. So I do research and I do social media content creation, and I'm kind of trying to figure out still working on figuring out what the business is. It's hard to be an anti-capitalist sole proprietor. But yeah, I do research into weight stigma and I teach people about it. And I'm so happy to be here.
Awesome. Yeah. Thank you so much to all the panelists. I think it's, each of you are awesome and inspiring individually. And I love that we've got kind of a diverse array of perspectives and backgrounds represented on the panel as well. And just like your academic work and what you're doing now and your perspectives. Yeah, so I think we'll kind of get into it. We've got a few big questions that we're going to try to tackle today. And the first one of those is to kind of set the scene. I want to know, okay, what is the history of this obesity prevention kind of movement strategy? So like, how do we get to this point? And what truly is the relationship between health and body size, if there is one? So Harriet, can we start with you?
Sure. If you really look at the history, and Sabrina Strings has done some of this in her really wonderful book, Fearing the Black Body. Yep, there it is. And other writers have looked at it too. Amy Erdman Farrell in Fat Shame. Look at that. It's almost like we planned it, but we didn't. The history of fat phobia is also the history of racism in this country, for sure. It's the history of the white, affluent, elite Protestants, because that's who they were at that time, who wanted to be separate from everyone who came after them. And that's the very short version, and I'm sure we'll go into it in more detail, but you really can't separate weight stigma and those sort of slim white body ideals from talking about racism, ableism, xenophobia, all of that. It's all connected. The white Anglo-Saxon Protestants didn't want to be, thought of as being like the Irish, for example, or the Italians, and as each wave of immigration came to the States, they were different people from different parts of the world. They were different body types. And also the giant issue of, nobody, to be anything and white was always considered better than to be a person of color, specifically an African or an enslaved person. So that's really, if you don't understand that, I think it's really hard to understand the animus that drives this. And I know that the other panelists have experienced this as well. You know, as a journalist, I've written about weight stigma for publications like the New York Times, you know, very well-respected publication. You know, I remember doing a story some years ago about specifically about weight stigma and how it affected people. And it was a reported piece. It wasn't me giving my opinion. And there were something like 1,000 comments on that piece, and 90% of them were vile, like just vile. And I get a lot of hate mail, and it's very personal, as I'm sure it is for you guys, if you've been exposed in that way. And so, I think it's really interesting that there's so much rage behind fatness and behind people's responses to it. And I think that that's a big part of the connection. So I don't want to take up more than my time, so I'll just quickly address the other thing you said, which was, what is the relationship between health and body weight? That's a giant question that basically has no answer. But the real answer to that is we don't know. We don't know that much, honestly. And we can't really know because you can't really ask that question without accounting for weight stigma and its effects on people. Just like we know that racism, homophobia, classism all affect people's physical and mental health, so does weight stigma. And much of what gets reported by places like Harvard or, places that are researching the O word, many of the illnesses that correlate with higher body weights, are very likely a function of people living in an oppressed situation over a long period of time, and an oppression that comes at them from everywhere. So, it always kills me when these studies come out and it's like, well, now we know that, like, you can't be fat and fit, or, whatever BS they're dropping. We actually don't know. We can't really know. I'm going to be quiet now and let someone else speak.
I thought that was a great answer. I just have one word that I want to add, which is eugenics. The history of obesity prevention is the history of eugenics in this country. The project of preventing obesity is a eugenic project. There is no me who is not fat. There is only the me who succeeded at killing herself. So like, take that as you will. But that is how a lot of fat people feel. And when we hear obesity prevention, we hear you're trying to murder us, either, through the denial of healthcare, through the denial of nutrition. It's bad out there for fat folks, friends, because it's eugenics. It's an approach to a bell curve that, all they did was they looked at they invented BMI so that they could see if they could make a bell curve. And then they made a bell curve, and then they said, oh, there's kind of sort of more disease in the ends. Let's just cut them off. Let's just cut the ends off. And that's the approach to the bell curve. And so like that, if that's where you are and you're in public health, maybe just reconsider. And like in that context, how do you draw a meaningful conclusion about how my weight affects my health? My weight affects my health through weight stigma, through every interaction I have with a doctor. And they don't go well. So that's me.
Yeah. So I'm trying to I don't want to repeat too much, but with regards to the sort of history of obesity prevention, there's this really fantastic book called Fit to be Citizens by Natalia Molina. She does this really incredible deep dive into how racialization occurred at the hands of the Los Angeles County Public Health Department in the 1800s, and like how that sort of created the groups of the sort of stereotypes that often still prevail about Chinese, Japanese, and Mexican immigrants. And one thing that really struck me this wasn't necessarily the focus of the book, although I kind of wish it was because it was really interesting. There is a part where there's a moment in time where Mexican immigrants are sort of seen as more assimilatable like in comparison to Chinese and Japanese immigrants for various reasons. And so the public health department sort of create these maternal and child health centers to sort of combat what they believe is a problem caused by lifestyle and behaviors, which, you know, obviously was completely ignoring the fact that these immigrants were often sequestered into areas of the city that had no sanitation systems and no running water, and were also like systematically discriminated against and also put to hard labor. Besides that, one of the main components that the Los Angeles County Public Health Department focused on was diet. And that was diet of expecting mothers, and also sort of diet that was anticipated to be passed down to children. And so when we think about obesity prevention as this ongoing eugenic project, as this effort to sort of craft people into the image of the thin white ideal, or, you know, the Anglo-American that is the standard for the American body, I think that there's just like so many little like remnants of obesity prevention that sort of began in other areas. And I think it's really fascinating how so much of the efforts to discipline bodies come from initiatives that targeted women of color and migrant women who were seen as sort of the holders of the next generation of people that would take over the country, like from whites that wanted to hold on to power and control. So, you know, if you read something like this one, I have books too, guys. If you read this, if you read something like this one, Fat Politics by J. Eric Oliver, which is a good book, I would suggest that you take what you need from it and then sort of leave other things behind. But it does give this really fascinating history and reviews the stakeholders that are invested in obesity prevention efforts and sort of the idea of obesity as a disease. And J. Eric Oliver sort of attributes it to this man named William, I don't know how to pronounce his last name. Is it Dietz or is it Dietz? But it's literally, what is it, Monica?
I would probably have said Dietz.
I thought Dietz because his name.
Because, well, if it's Dietz, it's probably Dietz, but Dietz is funnier.
His Dietz is funnier, and it also makes it also just like goes along with my point better. No, so J. Eric Oliver sort of attributes it to this guy. I'm gonna call him Dr. Dietz because that's like just what it is. J. Eric Oliver attributes it to this person, Dr. Dietz, who was a director, I think, of a division of nutrition at the CDC after leaving Tufts University. And he gave a PowerPoint presentation that J. Eric Oliver says sort of stoked the initial like panic about obesity as an epidemic, as something that people could catch. And I think that it's useful to be able to pin something onto one person, but it sort of obscures the fact that this is something that comes from generations upon generations of racism, anti-Blackness, and a much longer history of imperialism and colonialism that, you know, just happened to be imbibed by people that then created efforts along the lines of what that ideology entailed. So yeah. Oh, also, yeah, relationship between fat and health, we will literally never know until fat phobia does not exist. So that's pretty much the it of it. But I will say that a lot of the health risks attributed to fatness or to obesity are like bullshit. And there are lots of resources that I'm sure are listed on that Fat Liberation document being circulated. So I would really encourage you to read them, especially the review that Monica linked to, because that one is very, very, very good.
Yeah, if I can just jump in with a story, as part of the research I was doing for a piece on the so-called obesity paradox, which, if you're not familiar with that, it's the fact that in many chronic diseases, especially diseases that are associated with obesity, like type 2 diabetes, like cardiovascular issues, heart failure, lots of these. What's really interesting is that once people are sick with these diseases, very often it's the people in larger bodies with the higher BMIs and weights who do better. They live longer and they have less comorbidities, less illness. So naturally, the name obesity paradox suggests that, how could this be true? How could it possibly be true? So a lot of doctors have gone to research this. And I was interviewing this guy, Carl Levy is his name, and he's a cardiologist in Louisiana. And he's done like 7 studies on this in cardiovascular issues. And I was talking to him about it, and he was like, yes, pointing out this, that. And then at the end of our conversation, he said, oh, but I still always tell all my patients that, if you're fat, you need to lose weight. And I was like, wait, what? Like, how is that even possible, that you've just spent all these years doing this research and coming up with these findings, and yet you still. To me, that's like a perfect example of how deeply embedded this is in the medical world. So.
It's also just like we all know that's not possible, right? Like for the audience at home, long-term weight loss is rare and unpredictable. Even people who support it will concede that it works for maybe 20% of people, depending on how you define long-term and how much weight you're talking about. There are some people who lose substantial amounts of weight and then that's their body from now on. They are the extreme minority. Their quote unquote success is not replicable. And the advice that fat people are getting from their doctors in terms of diet and exercise is about what you would read in Cosmo. Like both in terms of level of like sense making and accuracy. So like, anyway, just wanted to make sure that was a point that got underscored.
And also the possible risks of weight cycling are like extremely dangerous. So these recommendations to tell people like, hey, you should lose this amount of weight that like probably isn't attainable, but you should do it anyway because we want you to be on this specific side of the curve. Those efforts that then sort of turn into this, like possibly losing weight, gaining weight, possibly losing weight, gaining weight, all of the possibly like sort of disordered eating habits that can sort of develop from that. There's so many risks associated with weight cycling that have a legitimate toll on the body. And I also think that we'll never understand the relationship between fatness and health because so many fat people find themselves in the cycle of weight cycling because of recommendations from public health professionals, because of recommendations from medical professionals. And so we'll never really understand what that is until we alter those recommendations and again, like tell fat phobia to fuck off and like keep it away. So yeah, just that was a point that I wanted to make sure got across.
That is such an important point because I know like when I was growing up, the idea was, well, yeah, it can't hurt you. So you go on a diet, you lose some weight. And I've had doctors say this to me, well, at least you're thin for a while. What? Like, that's not what the evidence says. That is not what the evidence says. The evidence says, plus every time you lose weight and regain it, talking about maybe more than 20 pounds or so, you're resetting your metabolism too. You're forcing your metabolism to become more and more efficient. So you're actually making it harder because your body's very good at homeostasis, right? It wants to like hold on to nutrients. It doesn't want to be starved. It needs that to work. So it's just, thank you for making that point.
Yeah, this has been awesome to just kind of witness this conversation. One thing that I wanted to touch on before we move on from this is, can we just talk about BMI for a second? Because I know in public health spheres, we're all about statistics and looking at big, patterns and information. And, Mikey mentioned bullshit earlier. So I figured we should just bring out the bullshit about BMI if someone wants to tackle that and explain why maybe we should just stop using that altogether.
Yes. We should stop using it altogether. I'm sure that a lot of the people watching this are like either students at UIC, public health professionals, or people who work with patients clinically. Stop using BMI. Just don't use it. Just divest from it. Like, literally do not use it. Don't use it. Don't use it. You can't say no one else. You can't say no one told you not to use it. I'm telling you, don't use it. First of all, it's a bad measurement of body fatness. There are like so many different measurements of body fatness, but also the larger point is that we don't need to measure fatness. Like, we don't need to. It's not a thing that we need to do. Unless we're trying to understand how certain forms of fatness impact experiences of stigma. And like, I think if we're researching that, like, we already know like what that is. Like, we could talk about how different forms of fat distribution absolutely impacts the kind of stigma that people face. Like, if you have an hourglass figure and you are a fat person, and let's say you are well proportioned, like, the stigma that you face is absolutely going to be different, possibly less so or just differently expressed than someone else who has major fat deposits in their stomach and like isn't as like ideally curved. Like, so if we're talking about fat distribution, there are better things that we can use. But also, BMI was never intended to be an individual measure of weight. Like, oh my God, like, Monica and Harriet, I'm sure, can like articulate this better than I can, because I just get enraged. But yeah, I'm gonna stop talking. Please take this away from me.
I mean, honestly, like, I don't like, there's a really good article. There's a really good article called The Bizarre Racist History of the BMI. And like, I'm not like, so that was written by Aubrey Gordon, I think, who is your fat friend. She just published a book. Like, I'm never gonna explain it better than Aubrey can. Like, it's, the long story is that it's bullshit. The short story is it's bullshit. The long story is like, two deeply racist men playing with numbers, having fun. Like, it's not good. I will say that the one thing that BMI can be sometimes kind of good for is that it does track really well with how much weight stigma a person experiences, because it's used to enact weight stigma. So like, the first rule of tautology club is the first rule of tautology club. That's an XKCD strip from when I was in high school that just like stuck with me. But like, yeah, so if you want to use BMI to talk about weight stigma, I personally feel like that's okay. But like, again, that's me personally, a fat person doing research in this space. I'm not the fat Lorax. I'm not gonna say that's okay for everybody.
Right. And then we've kind of talked about this already a bunch, but thinking about how weight stigma impacts health, right? So, and I also just wanted to bring in like the ways that stigma might manifest differently or to different degrees depending on someone's identities. And we talked about the racist roots of the obesity prevention movement. But I also just want to name like the ways that gender has an enormous impact on experiences of weight stigma. So if anyone has comments or thoughts on the way those identities play into weight stigma and the general link between weight stigma and health.
Well, I know I've seen, and unfortunately I can't come up with the reference right now, but I've seen someone has actually studied, gender and weight stigma, and they came up with this, finding that like, I think women start to experience weight stigma in the doctor's office when they're about 10 to 13 pounds overweight. And I'm using that word in quotes because it's also a terrible word. You should never use it. And we can talk about language and what words are good to use. But whereas for men, it was something like 40 pounds, right? So, you know, so much of weight stigma, yes, it is tied to racism, but it's also tied to misogyny and to this idea that, you know, women need to be smaller, women need to take up less space, women need to disappear, women need to be reduced to the smallest possible body, etc. Whereas for men, you know, and they have a different kind of power in our culture, agonic power. Their power comes from what they do, and they are supposed to take up space. So gender definitely plays a role.
I looked at my first paper that I did in grad school about weight stigma was I was trying to do a review. I took obesity epidemiology. I had to learn what the enemy was saying to outsmart them. The professors did not like me. And I tried to write a review about weight stigma and gender. And what I found was that looking at the data that was out there was that I could not write a paper about weight stigma and gender without also including race, because race so strongly moderates how like the gendered experiences of weight stigma. And that's even into like Black men sometimes reporting that people are, you know, fat Black men reporting that like people are sometimes a little bit nicer to them than lighter, you know, than less heavy Black men, because like the weight stigma and the racism are doing a thing. That, you know, it depends so much on the context, like Harriet was saying, being really specific with medicine. It depends so much on the context. It depends so much on who's enacting it. But also in my experience, ableism and I'm blanking, heterosexism. So sort of the idea, I like talking about heterosexism as all one thing. So that's like sexism and homophobia and transphobia. The idea that there is a gender binary and you have to do it correctly, which means being the gender that we said you should be and also being straight about it. And, you know, as a queer person who had diagnoses and disabilities missed because I would go to the doctor's office and they would just be like, no, she's just fat. You know, like it like fucked me up really bad. And it's really hard to be experiencing multiple forms of oppression and have the language for none of them. And then also kind of one thing that I've observed or experienced is that it seems like weight stigma is like a vehicle for other forms of oppression to happen. And what I mean by that is that, right, like when a doctor says, oh, she's just fat, she doesn't need any intervention for her messed up ankles, right? Like they're doing ableism. They're denying me healthcare for a disability. They're saying I don't need to be diagnosed, but they're doing it through fat phobia. Or when I go to the doctor and I say, hey, I'm having pain, can you look at this pain? And they tell me no, lose weight. I'm one of those women who's getting turned away from the doctor's office, right? Like we know that women take a long time to get diagnosed with certain issues. I become one of those women who gets turned away for chronic pain, but they're not saying like, go home lady, you're a lady. They're saying go home fatty, you're fat. So that's what I mean. And I think that is a really underappreciated element of fat phobia, is that it's not usually like alone in the room. It's usually, it's bad that you're fat because you're also disabled. It's bad that you're fat because you're also queer, or at least that's been in my experience. Yeah, did I answer the questions?
Mikey, add on something?
Yeah. So I think about this a lot because this is sort of exactly what I, hopefully doing my dissertation on. Although for all my PhD students in the room, you'll see that'll probably change like a billion times before you actually get to that point. So in terms of gender and race and fat phobia, I think a lot about sort of the stereotypes of the Black woman, like Mammy, Jezebel. And I also think about stereotypes for Black men. And Monica, you really made me think about how, like, you know, Black men who are of higher weight seen as like, you know, less threatening or whatever, in versus Black men who are thinner. I think this all boils down to notions of labor and like enslaved labor. I think a lot about how dark-skinned fat women are seen as inherently pathologized in ways that Black women who are thin are not. And I also think about how pathologization sort of differs across skin tones and features and weight and gender and sexual orientation and gender identity. When we think about weight as a spectrum, I sort of think about how what the repercussions are of not fitting into the ideal mold for your skin tone, for your race, and for your class. So what kind of consequences is a dark-skinned woman who's fat, what kind of consequences is she facing versus a light-skinned Black woman who is also fat? And I've seen some people, especially like those who do sort of like critical whiteness studies, this is like getting way into the weeds here, who talk about how fat white people experience specific kinds of weight stigma because they're almost seen to be considered as failed white people. So yeah, I think I saw somebody write it in the chat, like intersectionality is absolutely key. And I think that until we fully understand weight stigma, for example, like as a vehicle maybe for other forms of discrimination, we won't fully understand effects on health because you know, in public health, we want to like isolate we want to isolate factors. We want to see what the impact is, what the relationship is. But that's not really possible in like the real world. Like I know that that's something that we all learn about, you know, like, we do like a logistic regression and try to isolate this one variable and see how this like affects this whatever relationship. But that's when it comes to things like discrimination, fat phobia, racism, anti-Blackness, ableism, like these are things that cannot be isolated. And so again, like trying to isolate something for the sake of understanding its effect on health, who is that for? If we decide that we can implement an intervention, and I see somebody talking about childhood obesity stuff, which like always gets my gears going because my first exposure to public health was as a child seeing public health messaging about obesity and specific like public health messaging about obesity targeted towards Black and Latino people. Whether, you know, I don't know how familiar people are, but like the world of culturally sensitive weight loss or like physical activity or diet interventions. But there's something very, very insidious about targeting a specific population and telling them that everything they do is wrong because they don't fit into the mold of the ideal white body. And so, yeah, these are just things that I come back to when I try to sort of parse out the knots that exist. Like when we're talking about like different forms of oppression and health status, it's all like very messy. And I think that public health sort of shies away from things that are messy because, you know, that's not what we want. We want things that are, we want to be able to like report a finding in a journal and be like, oh, this is like the thing that results in this thing. And if we change this thing through this whatever intervention, then like we can fix this outcome or whatever. And like, that's not useful. I am having a good day. And I think that since we're talking about this like in the context where like, you know, this is being hosted by School of Public Health, I think it's important to just say these things because, you know, for those of you who are training to be public health professionals, if someone says that it's important to isolate a specific variable in order to do a specific intervention, try to think about who is that for? Like, if the goal is to isolate this one variable so that it's easy for us to implement an intervention, is that for the community or is that for the researcher that wants to write a grant and like get something funded? And of course, you know, we could have a whole conversation about people creating whole careers out of funding interventions that target Black and other people of color, but we don't have enough time. So
Yeah.
yeah.
Thank you. That was a
Please,
perfect
Seth, cut me off. I'm like, I could literally talk about this all day. Just
You're good.
yeah.
Yeah, that was a perfect segue to my last question before we get to audience Q&A. And I know I want to make sure we have enough time for that, but I just want to ask this last question and we can try to have brief responses because then other people will get the chance to ask questions. But you were talking about like what public health people do, right? So how do we move from what we've been doing and all the history we talked about with obesity prevention? How do we move to public health working towards fat liberation? Like, what does that look like concretely? What should public health people be doing?
I have lots of opinions on this, unless Harriet and Monica want to go first.
No, I want to go second though.
Okay.
I just want to go at some point.
Okay, cool. I think the first step towards fixing or reimagining, right? I think that's the nice word. So I'm going to use the nice word. Sort of reimagining what public health can do. We have to widen the scope of what we think public health is. So there's a lot of different public health activities. There's surveillance, there's interventions, there's education, communication, whatever. I am currently in the middle of trying to think through what would it look like if public health, for example, in the middle of this pandemic, was equipped and had the political will to fill in gaps that have been left by the federal government to support people who are hungry, cannot pay rent, are experiencing unprecedented amounts of financial strife. What would it look like if we shifted our focus away from focusing on a community, a type of person, an outcome, an illness, to making life better for people? And I think that that's where it really comes in. We need to fully let go of this idea that like public health is an extension of medical work that occurs within the clinical bounds of the hospital or the you know, the doctor's office, and understand that it can be something completely different if we actually gave a shit about social determinants of health and stopped paying lip service to the things that make people sick. Yeah. So I'm gonna leave it there. Somebody go after me, please.
I love that you were like, we have to do more, we have to dream bigger, because I think that's right. I think that we are like this is a great start. This is a really awesome start. Claps for the organizing team, because this is how it starts. I, you know, like admitting more fat people to public health school might help, but also like, look, like it's hard because everybody's doing Zoom school now, but like if we were in a real space, I would ask you to like look around your physical school space and like, what are the chairs like? Are you using like equipment and structures that are actively keeping fat people out of your school? Probably, because there were some classrooms at my school that made me want to die. So like that, looking at like the material, structural, right in front of your face stuff, important. I think talking about the curriculum, and right, like I think we need a lot of curriculum changes in public health schools, in medical schools, in nursing schools, and all of the other health professions that I haven't named, but it's not because I don't love them, it's just because my memory is bad. Schools, that's a big thing to me. And then also like we have to talk about bariatrics. We have to talk about the fact that there is an industry, a predatory industry that mutilates fat people's healthy digestive systems in ways that do not necessarily improve their health, for the sake of weight loss, not even guaranteed weight loss, that a lot of my understanding is that a lot of the weight loss surgeries were invented to treat like otherwise deadly stomach cancers. And then they just started doing them to fat people willy-nilly once they realized they sort of lost weight after a couple years, or a couple years after. But fat people do have special certain medical needs that are generally not being met, not being supported. Fat people are routinely turned away from all kinds of surgeries just based on for no reason other than doctors aren't getting trained with fat people, so then they're not comfortable doing the surgeries on us, and or like the equipment isn't right for our bodies. And so we have worse outcomes, and then doctors get stressed out about how fat people are harder to operate on, so then they don't want to operate on us. So like, but bariatrics, weight loss surgery, there are surgeons who do operate on fat people day in, day out all the time. Like, those people need to be training all the other surgeons on how to manage fat bodies, is what I would like to see, is no more weight loss surgery. Bariatric surgeons are allowed to specialize in operating on fat bodies because operating on fat bodies is a specialty. But like or like there are conditions that fat people are more prone to. There's a skin condition called hidradenitis suppurativa, which basically means like you get boils. It's annoying. But there's no treatment. There's no guidance. If you talk to a doctor about it, they're like, "What are you talking about?" Like, it's rough out there. So like, if all of the energy that is poured into preventing fat people from existing could be poured into actually supporting our health, that would be super. That would be really great. I would appreciate that. I think that's kind of my speech.
So I think the main point I want to make is that we use weight as a proxy for health, even though we know that it's not, right? We know that we can't actually say what the relationship between weight and health is because of weight stigma, fat phobia, all of that. So therefore, every study that comes out that says, look, fat people are in worse health, it's being used as a proxy. And I think much in the same way BMI is used as a proxy because it's easy, right? And it's like a kind of shorthand. So to me, it just makes a lot of sense for public health and medicine to focus instead on actual measures of health, right? So for example, every time a fat person maybe starts to exercise, maybe loses some weight, any health gains are always attributed to the weight loss rather than the health behavior, which, perhaps inadvertently led to some weight loss. So if we can just take weight and put it aside, right, and take what I guess you might call it a weight neutral approach and say, let's look at actual biomarkers of physical health and mental health too, then you get a very different picture, and if you look at the research of Ellen Satter, for example, who's looked at what she calls competent eating, which is very similar to like the idea of intuitive eating, right? And it's, competent eaters in Satter's research do better on every health marker, blood pressure, glucose levels, and anything you can measure like that. But their weight may or may not be lower, right? They may or may not lose weight. So I just don't understand why this drumbeat of emphasis on weight as a proxy. And I think, why is it that when I go to the pulmonologist's office, I have to get on a scale? What is that about? Like, I think if we actually take that and separate it from what you're actually trying to measure and address, you would find there is no real connection, and we could speak to health, we could encourage healthy behaviors, we could talk to people about nutrition in ways that have nothing to do with what size their body is. Okay, I'm off the soapbox now.
Thanks so much for all of that. So I'm going to turn things over to Marjorie now. Marjorie has been dutifully monitoring the chat, so thank you for doing that. And we'll have some chat questions. Feel free to also raise your hand. No guarantees we'll get to everybody. A lot of people here, but we're going to do our best to take advantage of the knowledge and experience that all of our panelists have. So I'll turn things over to Marjorie.
Yeah, thank you, Seth. And I, as folks were submitting in the chat, was asking if they felt comfortable asking out loud. So we'll do a mix of folks asking their own questions out loud if they're comfortable, as well as me reading some questions that folks submitted. So either way, if you have a question that you'd like to ask and you haven't put it in the chat yet and you'd like me to read it, feel free to just private message it to me. But if I see we have 4 folks with their hands raised. So Elise, do you want to go ahead and start us off with a question, and then I'll read one from one that someone wanted me to read.
Sure. Thanks, Marjorie. I just want to start off by saying thank you. I'm sure this is a sentiment echoed by everyone on, but I myself am a fat person, and I have been since childhood. And this is I'm sorry, this is a deeply meaningful, deeply personal issue for me. I'm in recovery for an eating disorder, and last year I had to take a leave for mental health because of the shame and the stigma and suicidal thoughts. And yeah, so thank you. Thank you a lot. I don't know if I'll get through my question, but I will try. I work in healthcare, and I feel like a fraud as a fat person who works in healthcare. And every time BMI gets brought up, I sort of feel like, no pun intended, the elephant in the room. My team did a lot of work on COVID, and with all of that research that's coming out, that basically is like, you know, your higher BMI, you're more likely to die of COVID. It sort of feels like the conclusion is it's fat people's fault. And my question is just, how do you change that conversation? I'm not a physician. I don't have a PhD. I'm literally just a fat person. I don't know why people would listen to me to change that conversation without dismissing me. But I really do want to start confronting these assumptions and saying, why are we breaking down the data by BMI? Or why aren't we breaking it down by race or gender or socioeconomic status or zip code in addition to see what's overlaying it? You know, like so many of you, what if that person avoided going to the doctor because the answer was going to be you're fat instead of treating their symptoms? I feel like I'm in the system and I want to challenge it. And I could just use some advice on how. So sorry for crying over everybody, but this is great. I want to hang out with all of you. Please be my friends and tell me about the schools you went to. I feel like I got to orient my life this way.
Yeah, Elise, I'm going to jump in. I thank you for sharing all of that. That was really powerful. Resonated a lot with me. I'm also a big time crier. So no shame, no judgment. That's how you know it's important, is if you're crying. That's how you know it's important. And it's just your body letting the stress hormones out. You're just like, oh, overflow. It's okay. I have a tendency to think that I need to do everything all alone and by myself, and like I need to be the person, and that's not true. So the thing that I would say to you is find your allies. Find your allies in your workplace, in your classes. I had a lot of success in my classes with asking questions where I did not expect the professor to have a good answer. I kind of expected the professor to say something fucking stupid. But I knew that it would give me an opening. And it was a chance to be a dissenter for the sake of being a dissenter. And at the beginning of my higher education, my master's degree, it was really stressful and scary. And by the end, I had, and I was in a 3-semester program, it was not long, but by the end, I had a team of people so that when I asked a question about the ethics, ethics are always a good question to ask because you're not going to talk about it enough in your curriculum. So just asking what are the ethics? What are the side effects? Because those are things about weight loss, especially that don't get talked about. So I asked, it was a behavioral economics lecture. And so the professor was talking about, you have to structure the incentives in particular ways because people will start to gain weight back. And I said, well, if everybody starts to gain weight back, is it really ethical to be recommending a blanket thing that's going to fail? And the professor basically responded to my body, made an assumption about the size of my body and tried to draw a distinction between obese and overweight. And luckily I had 5 people in the room with me. You know, it's like a 40-person, 50-person class, but there are 5 people in the room with me who are my good friends who I really trust. And so 2 of them are texting me like, yes, that just happened and you're okay. One of them finds me after the class and says, that was a terrible response, but I saw the light bulb go on for like 5 people around the room when you asked that question. And then I had one friend just like lurking in the back, like, do you need a hug? So find your people, because it gets a lot easier when you have your people. I will be your people now. I'm your people. You will always have me. Yeah, that's my advice. Somebody else talk now.
I am also your people. And that was honestly a lot of what I wanted to say. Like, no one at Brown does fat stigma stuff. There's like there's one other PhD student in like the American Studies department. There's literally nobody in the School of Public Health who studies this. Nobody who works outside of the weight-centric paradigm. No one who does that work. I'm the first person. And I'm also in a department that focuses heavily on obesity work, and who focuses heavily, like very heavily, like in that area. And that's one of the top 3 things they do. And I thought that switching to this area was like going to make everything really hard and horrible, and I wasn't going to have anybody, you know, any colleagues like who would find value in my work. And that's like not actually been the case. A lot of like people in my cohort have actually like reached out to me and been like, hey, let's find a way to like make the school more accessible for fat students. And like, that is the most beautiful thing that like I think anybody could ever say to me. Like, just that I think you'll be surprised that even if the person you're speaking to is like completely dismissive of everything you have to say, you'll find that there are people around you. Like those things, they reverb, you know, they ricochet, like people catch them. And once you start to plant the seed in people's minds, especially with something like this, that is so like heavily loaded with shame and stigma, once people see like, oh, maybe my body doesn't make me deficient. Once they start to have that idea that that's a possibility, you'll find that a lot of really wonderful, powerful things can happen. And so even if the person that you're trying to target might not necessarily be interested in what you have to say, there are other people who are going to pick that up and absorb that. And that's the thing that I've been so surprised and like, just like, you know, so pleased by. But yeah, I'm your people. So if you have social media, put it in the chat and I will follow you and we will talk. You're not alone. So.
Yes, likewise. And I just want to add from a different perspective. I started teaching undergraduates about this because it was, you know, because I'm also, like a lot of people are saying in the chat, I'm like the one person at my university. And I know that my colleagues are like, oh my God, there she goes again with that fat person stuff. Like, can you just shut her up? You know? You figure out ways to talk to people. And I'm just interested in the fact that one of the things that seems to be really helpful in talking to like undergraduates about this stuff is when you show them stuff and then ask them, go home and talk to your family about this. Like talk to people who don't necessarily buy into this. And they often come back with these amazing experiences. And sometimes they come back saying, yeah, my parents laughed at me and, you know, left the table. But there are going to be people who just won't get it, who won't buy it. But as both Mikey and Monica said, there's going to be those people around who do, and you just have to find them. I mean, think about all of the other social movements that have gained traction. You know, it seems like nothing happens. It seems like nothing happens. But every person you talk to, you're sort of building that community. And eventually, I have to think there's going to be a tipping point, I hope.
Thank you so much.
Great, thanks everyone. I'm gonna read, we probably have time for 2 more questions, maybe 3 if we're especially quick. I know we're running short on time. There's never enough time to talk about stuff like this. So we had a couple of questions related to folks' relationship with providers. So I kind of sandwiched them together. So we'll see if we can do 2 at the same time. But How can folks be best support, or how can providers best support folks who are recovering from eating disorders in larger bodies? And how can folks set boundaries with their physicians?
In terms of setting boundaries with physicians, this is something that's on my mind because I've had to do it with some physicians lately. I was at a doctor's office. I walked in, they were like, oh, can you hop on the scale? And I've developed a way of just saying, oh, no, thanks. Like they're offering me a cup of coffee. No, thanks. And so I think there's ways to like just be very straight up and matter of fact about it. Like, no, not going to get weighed. You can put that in my chart. That's fine. But very often the advice is get a new doctor, unfortunately, because very often, I've had knee problems for many years. I'd been seeing a surgeon. We knew that knee replacement was going to be needed at some point. And he shocked me by saying, when it got to that point, you're too fat. I won't do it for you. I went and found another surgeon who did it. It went beautifully. Everything was fine, at the end. So I think maybe setting boundaries sometimes is not wasting your energy on people on doctors who cannot be educated, who are not open to listening, and just, you're the consumer. You're buying the healthcare. You have the right to go look for another provider. Just a reminder of that.
I actually want to jump in and immediately say something contradictory.
Okay.
To start, I'm sorry. I feel pretty strongly like, yes, sometimes finding another doctor is the best or even the only option. And I feel really strongly that should not be the advice that we're giving each other, because that is an individual solution to a systemic problem, right? The problem is that all doctors are trained in the same way to be fat phobic, and you might just luck out and find one who's not fat phobic. I had a really bad experience a couple of years ago where I had a PCP. She said something fat phobic. I found a different PCP. I talked to her about the fat phobia of the last PCP. I came to see her one more time. She also said something fat phobic. So like finding another doctor can be a solution, but it is financially punitive. It is emotionally exhausting, right? Because the other thing was then I like got billed for like 2 new provider appointments in the same year or whatever. Like it is bad. And I don't have better advice. I just feel strongly that it's not enough to especially be telling each other, go find another doctor, because there is no guarantee that the other doctor will be better. And so like one of the things that I'm really focused on doing is trying to find ways to empower clinicians. So sort of going back to the first question, which was how do providers support people who are recovering from eating disorders in larger bodies? And I mean, I would say, number one, be aware that every single colleague you have is actively sabotaging that person's recovery. Every single colleague you have maybe isn't actually actively sabotaging, but like has the potential to be or could be actively sabotaging your patient's recovery. So just being aware that fat phobia is relentless and ongoing and present in every single sector of our lives, I think goes a long way, because most providers have no understanding. And yeah, doing the work to educate your colleagues, to push back when they say things like, unfortunately, I think clinicians feel like, I can't push back because I have to maintain a working relationship. And I would just ask, who are your working relationships serving? Are they serving you, or are they serving your patients? So yeah, I think that's what I would say.
I agree with you totally that we have to address, we have to like find systemic ways to push back against this. And that's one reason why one of the projects I'm working on right now is I'm pulling together a group of people, maybe you want to be part of it, to work on curricula for various health professionals, med schools, nurse practitioners, dietitians, whatever. So I'll hit you up.
Yes, please.
Great. And I think maybe one or two more questions. We'll see how we're doing. So Rebecca, you have your hand raised. Do you want to go ahead and ask your question? Thanks.
Yeah. Hi. Thank you for calling on me. And Elise, thank you for being here. I'm Grace's friend. I'm just glad you're here. Yeah, glad you could join us. Thanks to the panelists too. My question is just about I'm in the public health program, and it's inherently paternalistic, but there's all this I have a lot of colleagues who are doing research on childhood obesity and childhood obesity policy. And there's this huge push for prevention, and I'm just curious. I don't have a pointed question on it, but I've always stayed away from obesity with a 10-foot pole since I got to grad school, because I was I wholeheartedly don't agree with the kind of politics behind it. So I'm just curious, what any of the panelists think. This is just for anybody. If there's a way to do this. I guess just what do you think about policy around obesity and trying to prevent it in children? It seems like there's this upcoming we got to stop it now kind of attitude. It's just this huge fear around obesity. So if anybody wants to say anything about that.
No. My answer to policy for childhood obesity, and this is something that I actually got into a whole thing with somebody in my cohort about, because this was their area. There is nothing positive to be gained by policing children's bodies. Not a single thing. I think my first forms of disordered eating began when I was 8. And they were because I was constantly imbibing this messaging that my body was wrong, that my body was going to kill me, that my body was deficient, and that the reason why my body was wrong was not only because I didn't know how to control myself, but because my entire culture was wrong. And the way that we ate was wrong. So I think that if somebody's interested in childhood obesity prevention, first I would ask what exactly the goal is. If it's just to make kids thinner, I think that's really weird, and I'm not exactly sure what is to be gained by that. But if it's to tackle some other form of outcome, maybe physical activity, maybe it's this concept of healthier eating, which is incredibly problematic, and I would encourage everyone to read about healthism and food. I would ask what outcome they're trying to tackle, because if it's something, for example, like physical activity, there can be joyful movement if you are in a fat body. The thing that discourages movement in a fat body is fat phobia. The thing that literally keeps me away from I have such a complicated relationship with exercise now, and it's literally because every single time I have tried to go to a gym, be in public, to take up these non-sedentary lifestyle behaviors, the thing that's discouraged me is literal fat phobia that I've experienced in public, that I've experienced in private, that I've experienced online, that I've experienced in all different kinds of forms, academic, personal. That is what stops people from feeling like they can move their bodies, feeling like they can own their bodies. Because when you start to tell somebody that their body is deficient, they want to distance themselves from their body as much as possible. And so they just don't do anything with it. And I wish that I could explain that to people who, for example, who worked on the Verb project. That was a very big public health initiative. It was all about physical activity in childhood and everything. And I just wish that a single person working on that initiative had given a single shit about weight stigma and its effects on physical activity uptake, because it's so incredibly counterintuitive. But yeah, the short of it is that there's absolutely nothing to be gained by policing children's bodies. We should be telling children that they should eat what makes their bodies feel good. And that can take a wide range of things. That could be emotionally well, that could be physically well. There's comfort to be found in food. And I think that we should stop trying to get away from that as a general practice, because then when we're like, no, you're not supposed to use food for pleasure, and we start to drift towards the idea that food is some kind of like medicine for the body, then that's how we begin to moralize eating. And that's literally how we develop like negative relationships with food. So yeah, that's my take on that. I would honestly be shocked if I ever saw a childhood obesity prevention policy that like was useful in any kind of way. And that's just like, that's a blanket statement that I will absolutely stand behind. So yeah.
I would just like to add that my 14-year-old daughter, her anorexia was triggered, not caused, obviously. There were a lot of factors going into it, but was triggered by an 8th grade health class, where they talked about obesity and where they talked about, the need to eat right and exercise. And, because she was wired the way she was and had the personality that she did and the genetic predisposition, for her, that sent her down a path that led to her almost dying. So, I think like elementary school and middle school and high school are places where a lot of harm is done and really no good ever happens. Like I tried going and presenting to like the staff at her school, for example, right, to talk to them about why the class as it was being taught was problematic, not just for my daughter, but for a lot of them. And, at that time they couldn't hear it, but that was, 15 years ago. So I don't know.
Great. Well, thank you all. And thank you for the questions. Unfortunately, we're almost at time and we have just a few wrap-up tasks. Oh, Monica, did you want to say something?
Can I add 1 second?
Yeah, absolutely. Please.
Is just everybody said great things, but I just want to say like Rebecca, a really concrete thing that you can ask is like, are you looking for unintended outcomes in your study? Are you measuring the incidence of eating disorders in your intervention population? Because you're probably not, and you're fucking all those kids up. Okay, now I'm done. I yield my time.
Thank you so much. So Amanda, I'll have you put the slides up again. And while she's doing that, we would love for everyone's feedback. So I'm going to post a link to a survey. It will also be on the screen in a second. And so if you wouldn't mind sharing your feedback, there's also a space to ask questions that you might still have. So if you didn't get your question answered, I strongly encourage you to post it in there just so that, we can keep the dialogue going and figure out what questions folks might still have. And like Seth mentioned, we're hoping to do this again with some additional support from UIC funding wise. So hopefully there will be more of this to come. So this is just the short link. And I also posted in the chat. So either way, please fill out the survey and we can go to the next slide and I'll let one of my colleagues wrap everything up as well.
Cool. I don't know if we ever planned out who's doing the wrap up slide, but yeah, big thank you to the Collaboratory for Health Justice here at UIC, as well as the Center for Student Involvement. The Center for Student Involvement in particular provided the funding for our captioner. So thank you, Nicole, for the captions. And we always want to make sure that our events are as accessible as possible. So that was a big thing that we wanted to make sure that we had the funding to provide live captions for everybody. So thank you again for that. And a big thank you for all of our panelists. This was everything I ever dreamed of and more. So thank you so much to the three of you. This has been amazing. And yeah, I hope we can continue being within community with everybody here on the call, and we can all stay connected in the resource document, on social media, in real life one day. Yeah, just feeling very grateful right now. And thanks everyone for your time, and the panelists in particular for your expertise and wisdom for all of us.
And there's one more slide with just some ways to stay in touch with Radical Public Health. So this is an event that Radical Public Health kind of organized with the help of some other groups on campus. So, you know, this is what we're all about, is having conversations and kind of working radically towards addressing issues within public health. So we encourage any and all of you to join in whatever capacity that you can.
We can also send a follow-up email that will have the recording of this event as well, and it can contain our panelists' contact information that they're willing to provide if you'd like to reach out with them. But yeah, thank you again, panelists. Mikey, happy birthday. We really, really appreciate you and everyone who attended.
This was so much fun. Just thank you for having me, and this is just great. I can't wait to do something like this again. So just absolutely holler if this is something that's happening again.
Can we do one for my birthday? 16th.
When's your birthday, Monica?
Next week.
Oh no, yeah, we all have to come back and do happy birthdays for Monica too.
We'll redo.
No, it's the discussion though. It's the discussion that I'm after.
Yes.
I'm
And
just
hopefully, I
joking.
think at least for all of,
But also, am I joking? We'll talk.
I think we're all serious. I think this is something too that we, at least at UIC, would love to. This is not the only thing.
Yeah.
Right? It's not one and done. It's to continue to build this community and continue to have these conversations. And so hopefully this is something that we can continue to do and have you all come to. Thank you so much again for kicking it off with us.
So glad
Thank
you
you
did
for making this happen.
Yeah, thank you. It's fabulous. Everything I dreamed of as a professor in Fat and Feminism, Seth.
Harriet, can I just say, when he told me about taking that class, I was so jealous. I yelled at him a little.
Yeah. Well, I'm hoping to be able to teach it again, although the university puts a lot of obstacles in the way, I have to say. So, unfortunately.
Well, if you ever need a testimonial from a former student who can put some pressure on admin to
Excellent.
offer it, yeah, let me know.
I might hit you up for that.
So jealous. None of the cool fat studies people are Brown at all. But there's
You are.
I don't have like a thing, like
Yeah, I know.
So that's like a whole thing. But there's actually a really cool like student created course happening this semester on like fat phobia and diet culture in America. And I was like, oh, that's really cool. So things are catching on, guys. Things are happening.
I'm trying to get a fat studies minor started at my university.
Oh,
boy, that's a tough one. So if anyone has done that anywhere and has any advice, I would love to have it, because speaking of resistance, there is a lot of it.
I feel like Lori Cooper-Stahl would have something to say about that, because I feel like she teaches like fat study stuff pretty regularly, right? I don't know. At her university?
Yeah, I'll check.
Yeah.
I mean, I know her name, but I don't know her, so.
Yeah, no.
Harriet, have you tried like within particular departments, or like where were you thinking that would be housed?
Well, I was working with someone over in food studies, actually, a professor who very sadly and unexpectedly died. So I do have a small group of people from around campus who are perhaps like someone from the religion department, someone from women and gender studies, someone, it's definitely going to be a multidisciplinary thing. I'd love to house it at Newhouse, but I don't know if that's viable. So yeah, so I don't know. I'm trying to do a lot of things on my campus, and we'll see if any of them actually happen.
Yeah, that would be awesome. Yeah, I would be surprised if Newhouse was
yeah,
on board, but
yeah.
I'm sure there's folks in women's and gender studies, because I was a minor in WGF.
Yeah, maybe there, maybe Falk School of whatever their description is, but they house like a sort of grab bag of majors, exercise science, and where's the nutrition people? Can we talk about nutrition? The nutrition department hates my guts. So just every time someone asks me to give a talk and they're there, they're all like sitting there like with their arms crossed, looking really dour and really like
This is familiar to me.
Yeah.
I'm an RD, so it's kind of like two classes of people. I think there's ones that are on this spectrum, and there's ones that are like, I just can't, like, don't have any conversations with them.
Yeah. Oh, I can imagine.
Yeah, and the
An RD.
this is a big conversation to have in dietetics too. It's a huge, like, the entire curriculum similarly is extremely flawed. So
Yes. Yeah. Well, there again, like Ellen Satter, she started as an RD, I think. I'm pretty sure she was a dietitian and, working in the field, and then has sort of had a come to Jesus moment and was like, everything I'm doing is not helping people. Wait a minute. I have to think about this in a different way. And she just shifted the paradigm. And I really respect people who start like that and then come to that realization, like, I'm not actually helping people. People are not getting healthier.